Namaste everyone. Welcome to Karnamai Holistic. So today we are having this webinar on psoriasis, and Dr. Dhanwantri Jha from India, well-renowned Ayurveda MD doctor in Gujarat. He is going to be speaking with us regarding how Ayurveda or Panchakarma can help with psoriasis. He is also a MBBS doctor, and he completed his MBBS degree from renowned Hebei University, and then he went to Gujarat Ayurveda University to do his bachelor's in Ayurvedic medicine and surgery, and after that he did his postgraduate degree in Ayurveda as well. So he has years of clinical experience with Ayurveda and Panchakarma, and he is solely committed now to spreading the holistic wisdom of Ayurveda and Panchakarma in helping people heal through chronic illnesses and prevent diseases through holistic practices. And I welcome him today to speak with us about how Ayurveda might help psoriasis, or what are the reasons or causes, according to Ayurveda, that would lead to psoriasis, and what doshas impacted. So thank you so much, Dr. Jha, for being here with us. And I look forward to an amazing session, and keep your questions with you till the end. You can put them in the chat box if it comes to your mind, and later on we will go through them after the talk is over. So thank you, Dr.
Yes,
Jha.
thank you so much, Gauriji, for the wonderful introduction, and always a fan of Karunamai Holistic doing such a wonderful job for spreading the holistic sciences across the globe, I should say, not just Ayurveda, but all other things that you do. Gauriji, can you just give me the right to share the screen?
I just did.
Yes, thank you so much. God, I hope you can see my screen. Yes, namaste, everyone. Hello, I'm Dr. Dhanwantri Jha, and this image on your screens you can see is Lord Dhanwantri, the chief propagator of Ayurveda. And it would always be very great to sing a prayer to him before we start our session on Ayurveda. So I always like to do that. So you can just hear with me. Namami Dhanwantari Madidevam Sura Surervanditapadapad Loke Chararu Bhayamrutyunasham Dhataramisham Vividhoshadhina. This is basically a prayer to Lord Dhanwantri. We call him as the god of Ayurveda or the god of health. And basically we prayed to him that we pray to your lotus-like feet, and to the one who is known as someone who takes out illnesses, death, fear, and any other disorder or infirmity that a human can have, and one who has the knowledge of all the herbs and all the things in the world which can be used for human health. So that's Lord Dhanwantri. This is also the image from the temple in our campus, Ayurved Shankul, in our institute in India. Right. So today we are going to talk about one of the very, you can say, big issue these days relating to skin, that is psoriasis. One of the most dreadful skin disorders through which many, you can say at present, into the modern society, there are many cases. And if you see about 100% of the skin disorders, you will absolutely find about 50% with psoriasis. So that is how the level of the occurrence of psoriasis is seen across the globe, and not just India, but across, because there are main few things which are stress, alcohol, and smoking. These three things are the main causative factors for the whole combination which can cause psoriasis. And today we are going to learn about it, about psoriasis, about the Ayurvedic management, how Ayurveda approaches this. So let's move forward. We are going to see about the clinical presentation, diagnosis, managing, and everything about psoriasis today. Now, what basically is psoriasis? It is an inflammatory condition. So basically, there's an inflammation going on inside the body, and specifically with the organ skin. It is a hyperplastic disease. That means there is overgrowth of the external layers or the external cells of the skin, which is causing this excess of flaky nature into your body. So it's inflammatory and hyperplastic. So inflammation is already there, but above and over that, it is more of increased number of cells. It is characterized by erythema, that is red rashes sometimes that you see, and elevated scaly plaques. So you can see in the image, there are white scaly plaques, which comes like the scales of the fish. So it gets removed continuously, and that is the main characteristic of psoriasis. It is chronic. Many times people suffer with it from years altogether. It's not a new disease, even if you notice it recently, but the origin has been there into your body, or the inflammation has been there into your body since many years. It is relapsing. So many times what we see with psoriasis is at the start, when a person has psoriasis, it stays there, and after some time it goes away. And that is why the patients usually don't become a lot more serious about this disease, because it goes away at the start, and then after some time it relapses. Many times, even if they start with the modern medicine treatment, it relapses, it comes back, it tends to come back, right? So it is a relapsing chronic condition. The course of the disease is often very unpredictable. Many times it is said that it never gets cured and it stays with you throughout the life, because it keeps on occurring, reoccurring, relapsing, and you never know what is going to happen and when it is going to flare up, when it is going to subside. According to Ayurveda, psoriasis can be correlated to a skin disorder which we call as Siddhama. There are a set of Ayurvedic skin disorders under the disease umbrella of Kusht. And under that comes one disease which is known as Siddhama, where the exact description you can see, this is the exact description of Siddhama as a disease in Ayurveda. It says Shvetam Tamram Tanucha Tadruja. That means many times the flakes or the skin has certain patches which are white or coppery colored. So these are the references into Ayurveda where they exactly mention about psoriasis or a condition similar to psoriasis. And so you can understand that even before these texts were written, like about 5,000, 10,000 years ago, even during that time, such kind of disease was present. It can be correlated to chronic plaque psoriasis, basically, the Siddhama, where there is a clear demarcation with dry, white, silvery scales like the fish scales. Commonly, it involves the elbow, knee, lower back, but may also include scalp, nails, flexures, and palms. Because there has been a specific area told about this. That is why, even according to the modern science, there are different types of psoriasis. In that, the chronic plaque psoriasis is something which exactly matches this description. That is told in Siddhama. We also many times correlate it with a disease known as Ekushth in Ayurveda. It is a very common skin disorder, as I told, and the prevalence is variable between 0.3 to 2.5% of the total population, right? Prevalence is equal in males to females, and it is the estimated incidence is about 60 per 100,000 per year patients. So that is how dangerous it is, because this number is increasing day by day, and it is almost like twice doubled or tripled in the past few years because of a lot of other factors, a lot of autoimmune conditions, and a lot of also environmental and pollution related changes. The age of onset, basically the mean age of patients suffering with psoriasis, is seen around 23 to 37 years of age. So you can see average population aging around this. It is very difficult to find it into older ages or very younger ages, but it is still there. But this is the basic mean age for occurrence of psoriasis. There are two different basic peaks that we say that it can have a genetic association as well. So it can be an early onset when it is about 16 to 22 years of aged patient, adolescent, young children or youth may be suffering from it. It can be an early onset genetic association related disease. And it can also occur into the later stages at about 57 to 60 years of age if it is a genetic association related but late onset. The early onset one usually is more severe and more extensive, can be throughout the body, while the late onset one is usually into a very milder form and it affects only the first degree family members. So say if your parents are suffering from it, you may have it if it's a late onset genetic association related psoriasis. It is also quite possible, but in Ayurveda we usually say that even if there is a genetic association, it won't occur until and unless you follow the correct diet and lifestyle, or it can be delayed further later or into a very, very milder form, even if there is a genetic association. So that means that environmental factors, your diet, your lifestyle certainly plays a much more important role than the genetic association to this, right? So basically, we say that it is an autoimmune disorder. That means your body's own defense mechanism works against your own skin cells. And that is why it's very dreadful. And that is why we say that there has to be some association where your wrong diet and lifestyle are taking care of this or flaring up this and creating that autoimmune condition. It is usually a T cell mediated autoimmune response. Usually, when we see our immunity, there are two types of cells which play the most important role in creating immunity: the B cells and the T cells. Now, the T cells usually are known to destroy the uh, external foreign body, and that is why the destruction of skin basically occurs here, because it is a T cell mediated autoimmune response. So your body's own blood cells, own defense mechanism cells are working against your own skin here. And that is why that scaling, going away, that destruction of the skin basically. Currently, there's a hypothesis into modern medicine about it, that it is an unknown skin antigen stimulated immune response. So we don't know what kind of an antigen enters the body, and that is creating this autoimmune response. But it is not usually so, because there have been various antigens researches done, and many times some people say that they are certain types of antigen from the external environment, but then it doesn't prove the global presence of psoriasis. So that is why we don't know exactly about this according to the modern science. Antigen specific memory T cells are primary mediators. So basically, they say that the T cells in the body which start this response have a memory, have a past memory. They might have seen this antigen somewhere, and now when they see it, they create this autoimmune response, which is also very doubtful and very debatable hypothesis at present. It leads to impaired differentiation and hyperproliferation of keratinocytes. So basically, your skin cells are increased into number, they're scaling, they are completely different than the surrounding normal skin. So that is the basic condition into psoriasis, which is a T cell mediated autoimmune disorder. There are certain triggers which usually trigger this psoriasis into our body. First is infection. So usually we see that when you are suffering from a streptococcal infection or a viral disease, and after you have recovered from that bacterial infection or viral infection, as soon as the body is now going towards the normalcy, suddenly you start seeing psoriasis. Recently, we saw many patients who had suffered from COVID, and after they recovered from COVID, suddenly they started seeing the skin flakes on the scalp, on the chest, on the back, basically. That means it was triggered by the previously known infection, which is cured or is being cured or almost has cured, right? There can be a skin trauma thing like a Cobner phenomena, where we say that if there is some injury to your skin, maybe that can trigger the psoriasis into your body, that can create the autoimmune response in your body, which can cause psoriasis. There can be psychological stress, basically, as I told at the start as well. It is a disease which is hugely linked with stress. Stress can trigger psoriasis. It can also increase the say frequency, the recurrence, the relapsing, and the strength of the disorder. So that is psychological stress. Many times you see many patients who are very healthy throughout their life, live a very disciplined life, and even after that, because they are stressed somehow about certain things, it can also trigger their psoriasis in their body. There are certain known drugs like lithium or beta blockers which can trigger psoriasis. So these are the drugs usually used for hypertensive patients, heart related disorder patients. So you see many times the heart related patients, when they are for a very long time on the cardiac medicines, this can also trigger psoriasis. Sunburn, as I said, this also comes under the skin trauma of the Cobner phenomena, when sunburn can also trigger psoriasis. Metabolic, there are certain metabolic factors like calcium deficiency. There are certain hormonal factors. Many times during pregnancy, we see a lot of gestational psoriasis, what we call it as, because there are a lot of changes happening into the body. The hormones are haywired, and due to that, also many times we see a lot of females during their pregnancy suffering from psoriasis. This is the basic mechanism, the basic etiopathogenesis according to Ayurveda of what we call as samprapti in Ayurveda. So when there is stress in the mind, when there are changes into your lifestyle, wrong diet, wrong relationships, daily routine problems like you are waking up at night, sleeping during the daytime, such kind of wrongdoings, seasonal routine not being followed. Say, if you are into an autumn season where we say pitta is excessively more, and during that time you eat a lot of spicy, sour things, or into the spring season you eat a lot of cold and overnourishing diet. All such wrongdoings, all such wrong diet and lifestyle things can also cause that. The psoriasis, excessive skin production basically can happen because of that. Impact on the body, basically it alters the immune system. So whenever the mind is in stress and you are following wrong diet and lifestyle, which causes an impact on the body has to respond to something, and then it causes this thing which is psoriasis, which again causes stress, and it takes you to this very vicious cycle from which it is very difficult to come out, because psoriasis in itself has a huge impact on your mental aspect as well. You see the patients of psoriasis being more stressed after they see psoriasis skin condition on their skin more than what they were before. So it also has a huge psychological impact on the patient's mind. Usually, there are different presentations that we see into psoriasis. This is a classical psoriasis presentation. It is very well defined, sharply demarcated. That means you can see the normal skin on the side, completely different than the affected scaly psoriatic skin patches, right? It can be round or oval shaped. Usually, it occurs into certain cells, so it causes this shape. Usually it is very symmetrical on both the legs. So if it is on this knee or this leg, it will be on the other leg into the same position or almost around the same area. Erythematous raised plaques, so they are red and they are a bit raised than the normal skin level. Covered by white or silvery scales, as you can see in the picture, it can be white, it can be silvery. They are scales, it always scales. When you touch them or when you wipe them, it literally drains, the skin literally falls off, right? What are the common areas affected? It can affect any part of the body, but typically it starts with the scalp. So scalp is one of the most important regions where psoriasis can start. And that is why what happens is many times people misunderstand it to be dandruff, and then they don't, they keep on ignoring it, and it keeps on becoming a very chronic issue. Uh, Elbows are also one of the most known places where psoriasis can occur other than the scalp, right? Knees, sacrum, all such places you can see into the image, all the red marked area. These are the most common areas, but usually scalp, elbow, knees, and sacrum are the most important places. The extent of the disease can be anything. As I told, if it occurs into a very young person, it can be very extensive, can be throughout the body, even the face, even the chest, back, everything is involved. When it occurs into old age people, it can be very less, only restricted to an elbow or things like that, only restricted to the head at the start. So the extent can be varied, but these are the most common sites of psoriasis. Psychological impact, stigmatization, as I told you, it has a huge psychological impact on the patient's mind. Patients don't want to go out, they don't want to show their scales, they will wear caps or they will wear complete clothes where they don't want to show their patches, they don't want to go out. So, all such things. So, psoriasis causes as much disability as other major medical disorders. So, this is a paper published that they did for the psychological impact of psoriasis. There are different types, as I was telling you. The chronic plaque psoriasis that is mentioned in Ayurveda as symptoma, or cutate, or flexural, which occurs only at the joint spaces. Erythrodermic, where it is just red, there's no white or silvery scales there. It can be pustular. Sometimes there can be pus formation at the site as well, which is very atypical type of psoriasis. It is not very common with psoriasis. Localized and generalized, it can be both, again, the pustular variety. There are certain local forms which occur only at certain places, like the palmoplantar. That means it occurs on the palms or the feet or the soles, basically, right? It can only occur into the scalp, nowhere else in the body. Even after 10 years, 20 years, it will still be there only on the scalp. So that kind of local forms are there. There can be certain types where only nail, psoriatic onchodystrophy, is also seen. So these are all different types of psoriasis, right? Chronic plaque psoriasis, basically, as I told at the start, is the most common type. It affects about 85% of the patients suffering from psoriasis. The features are basically pink, well-defined plaques, silver scales, white scales. Lesions may be single or numerous. Plaques may involve large areas of the skin. Classically, it affects the elbows, knees, buttocks, and scalp. All the common things that we know about psoriasis is seen into the classic plaque psoriasis. The chronic plaque psoriasis that you see on the elbow. This is again on the elbow, chronic plaque psoriasis, a bit pinkish with scales clearly seen. This is again another type of chronic plaque psoriasis. This is a single patch, while here what you can see is there are numerous single lesions. These are not related to each other, and so they are single lesions. So this kind of chronic plaque psoriasis can also be seen. So many times what happens with this is we get confused. And the patients many times don't agree with the doctor that it's psoriasis, because they have seen on the internet that it is of a different thing. But in variety, in actuality, it can occur into very different ways. It can have different presentations. So all these things are psoriasis. It can differ from each other. White patches, silvery patches, no patches at all. So it can be all different types of psoriasis. This typically involving the breast and the abdomen, or the areas where sweat formation is there. So basically, it is nothing but a kind of place where there is injury to the skin or an infection occurring, and because of that, it is triggering the psoriasis. So all such places are related to that. The cutate psoriasis basically are very numerous and small lesions, 1 centimeter diameters. As I said in the previous picture as well, it was a chronic thing, but it was different. And this is different. These are single lesions, each lesion measuring just about 1 centimeter diameter. So that is cutate psoriasis basically. Pink with less scales. The scaling here is very less, right? Commonly found on the trunk and proximal limbs, typically seen in individuals less than 30 years of age. So this is very common with younger population, often preceded by an upper respiratory tract streptococcal infection. So many times with these people, these patients, you see that they complain of, oh, I had a long-standing cough and cold for say about 15, 20 days, 1 month. And after that, as soon as it went down, I got this kind of patches on my skin. So that is cutate psoriasis. It can also occur on the axilla. Again, the same reason, all the flexures of the body, all the joints of the body, it can occur there because of skin injury, skin trauma, sweating, infection, whatever may be the reason, right? But these are known as flexure psoriasis. It doesn't occur on the normal parts, but only at the places where joints of the body are there. The lesions in the skin folds are articularly groin, gluteal cleft, axilla, submammary glands regions, often minimal or absent scaling. No scaling is seen into these areas because these are naturally moist regions of the body with a less amount of skin or the muscle below that. May cause diagnostic difficulty when genital or perianal region is affected in isolation. Usually, what happens with flexure psoriasis is that patients would come to you in the form of, they would say, oh, it's an eczema or it's a skin infection, a fungal infection, and it is just at the perianal region or the genitals, and you would again think of it as a fungal infection and treat it, while it is actually a flexure psoriasis. So we need to take proper history regarding this. And when a proper history is taken, and when you know the exact reasons for it, you will understand when you see the scaling, when you see very closely the marks or the lesions, you understand. So that is basically related to the doctor, but still, it is very important because many times I have seen people starting with antifungal treatments and it increasing the psoriasis uh, or the amount or the strength of the disease, right? So this is the erythrodermic psoriasis. As you can see, the skin becomes absolutely red, a red hot like skin. And then above that, there are smaller patches of psoriasis. So generalized erythema covering the entire skin surface may evolve slowly from chronic plaque psoriasis or appear as eruptive phenomena. What happens into this erythrodermic is the variety that we saw at the start, the chronic plaque psoriasis, that can progress if it is not treated properly or is not treated, it can progress towards going to erythrodermic psoriasis. So it's an advanced stage, you can say. The patients may become febrile, hypothermic, and dehydrated. Many times we see a lot of dehydration into these patients as well. There's a lot of dryness of the skin. Complications include cardiac failure, infections, malabsorption, and anemia. Many times, these people tend to have a lot of vitamin deficiencies, mineral deficiencies, heart related issues. That is all because the skin is not able to perform its function of fighting with the infections or absorbing the nutrients, absorbing vitamin D, absorbing nutrients, all such things, minerals, micronutrients, macronutrients, which the skin helps in doing. So that is how all these things can occur as a complication, and it is a very severe condition. The patient appears absolutely red with such spots on the body, and you don't know what exactly is the condition, because it is also a very chronic condition there. Very uncommon as well, but still quite possible. These are, as I told you, the pustular psoriasis variety, where you can see pus onto the sides of psoriasis, which is again atypical type. The lesions can be more deep seated, but there will always be an association of fever or pustules, that means pus pockets into the whole body. This is the palmoplantar psoriasis. Just on the palms, you can see the psoriasis things, or on the sole. So it can be like that. It doesn't occur on any other part of the body. So this can also be a presentation. Then this is the scalp psoriasis. Typically, this is the area behind the ears where you can easily see. Otherwise, inside the scalp, it is very difficult to see because of the hairs. But these areas are the very, very quite common places where you see such thing. This is the scalp variety. It is on the scalp and it is located to the scalp, because these are local forms of psoriasis. This is nail psoriasis. As we talked about, it is again a very local variety, just occurs on the nails, nowhere else on the body. Again, a type of nail psoriasis. Then there is psoriatic arthritis. Now, this is a very, very important thing. And many times the patients of psoriasis go to doctors or come to doctors only for the problem of arthritis or pain into the joints to the doctor. And they don't tell about the skin, because they keep on ignoring it and they don't understand the relation or the correlation between arthritis and psoriasis. This is a variety which is known as psoriatic arthritis. So when there is a psoriasis into your body, may it be a local form, may it be a typical variety, may it be a atypical variety, that psoriasis can progress and go from further deep within, from the skin into your, just into your bones, and it can affect your bones as well there. And that is where it causes psoriatic arthritis. Approximately 5 to 20% of the patients of psoriasis suffer from arthritis. They have knee pain, joint swellings, especially the smaller fingers of the joints are affected. And there are different varieties to this psoriatic arthritis as well, right? It can affect the distal interphalanges, like the fingers and the toes. It is symmetrical polyarthritis, both hands or both limbs, both legs getting affected, or all such varieties where the clinical core expressions are very common. But as I told you, many times patient comes to us only with joint pain, and then it is on us to figure out if it was because of psoriasis. So the history plays a very, very important role into such conditions as well. How do we diagnose it? So there are different dermatological disorders which can resemble psoriasis. As I told, the flexural variety can look like an eczema or a fungal infection. It can be diagnosed clinically, basically by the appearance, by history of lesions, family history. Many times, as I told you, there's a genetic predisposition to it as well. And it is very, very important to consider the non-cutaneous complications. That means you also need to understand if there is an arthritis related to it, to the skin, or any other thing which is related to this, like a heart disorder because of psoriasis. So that is how we diagnose psoriasis, usually mostly clinical. There's no huge lab investigation related to this. So there are different varieties. These are the different diagnostic things that can come. These are different things. Like if it is a psoriasis, it can be some other disease as well, like tinea infection, eczema, seborrheic dermatitis, dandruff, as I told you, cutaneous T-cell lymphoma, all the cancer kind of things, fungal infections, candidiasis. There can be all different things which can look like psoriasis, and we need to demarcate, or we need to clearly differentiate between psoriasis and other disorders. Because as I told you, when you consider it as some other disease, and then you treat it as a fungal infection or a viral infection or a bacterial infection, you may end up increasing the frequency and the strength of the disease, right? Uh, According to Ayurveda, there's an approach that we have for psoriasis or siddhama or ekakusht. First of all, we understand the basic dosha involved. Now, Ayurveda is a science where we basically consider the whole body mechanism to be divided into three major categories or three physiological bases of the body. These are known as doshas or the humors of the body. These are Vat, Pitta, and Kapha. Vat is very dry, Pitta is hot or red, and Kapha is liquidy, mucus, heavy, right? So depending on this, we can categorize different things, different diseases. We use it basically for all the diseases. But in psoriasis, mostly, as we saw the types of psoriasis, it becomes much more important in that condition, right? So the first thing that we take into consideration is the dosha chikitsa. That means we see what dosha is involved and we treat that dosha. Then there is the dushya chikitsa. We understand what is the basic reason that has caused this, or the tissue in the body which is affected. Mostly it is the skin. So that is why we say that it is the ras dhatu. It is the liquid portion of the body that we need to treat. If there is psoriatic arthritis, we also treat the bone related issues according to Ayurveda. So we need to work on the bones or the liquid or the lymph of the body. Avastha anusar chikitsa, we see what stage is the disease into and we treat it according to that. So we also see that many times when your digestion is weak, if there is an ama is undigested food, your metabolism is weak, you need to control or cure or improve your metabolism first and then see for the disease. So that is Sam Niram condition that we call. Or if it is a new acute condition, or if it is a old chronic condition. So depending on this, the treatments would vary into Ayurveda, right? There is a disease. Now the approach after this comes as we go against the disease. There are certain herbs, certain medicines which directly act on the disease psoriasis, or we have another approach where we improve the mental and physical strength of the body to fight the disease. So there we don't do anything for the disease, but in that case, what we do is we try to increase or support the body in fighting the disorder. Because Ayurveda believes that it is your body who has to fight against the disease, and it is not some external thing that you give to fight the disease, right? And there is a rasayan chikitsa, because this is a recurring relapsing condition. We give certain drugs or herbs or food items which can be used for a very long time throughout the life so that the disease doesn't recur. So this is the rasayan chikitsa or naimittik chikitsa that we call. Now, what are the basic goals according to Ayurveda? The tailor-made management to individual and address both medical and psychological aspects. So basically, we have to take care, because as I told, it has a huge relation to stress or psychological factors, the psoriasis, right? So we need to not just see the physical symptoms, but the mental symptoms, and we have to try to improve both of them. We have to try to improve the quality of life. Many times the person is overstressed, overworked, or not scheduled, not planned. The day schedule is not good. All these things have to be improved. So to improve the quality of life basically for the patient, achieve a long-term remission and disease control, we have to see that the disease doesn't occur again and again, or even if there is a relapse because the patient is not following certain things, that we have to try that it doesn't occur for a very long time. Minimize the drug toxicity many times, because a lot of patients, as I told you, the cardiac patients, the hypertensive patients, the raised blood pressure patients, or the kidney related patients are on medicines, modern medicine, the synthetic medicines for a very, very long time. And that can also be one of the reason for the occurrence or triggering of psoriasis. So in that case, we have to see that the drug toxicity because of those drugs is minimized, or we try to cleanse that and we try to purify that, remove those toxins from the body. So to minimize the drug toxicity, there is our goal. Evaluate and monitor efficacy and suitability of individual treatments. So we need to exactly see. Many times for psoriasis, the main treatment in Ayurveda is Vaman. Vaman is emesis, where we make the person vomit out things, right? Vomit the doshas out. Now, the vomiting cannot be good for a very young patient, very thin patient, very weak patient. So, in that case, I need to assess if that condition, that particular condition, would be useful for the person or not. So that evaluation is very important. And we have to be a bit flexible because of the condition of the disease. The disease is very, very strong because it's a chronic disorder always. It has been seen recently, but the origin was very chronic. So you have to remain flexible with that and respond to changing needs. Many times the dosha variation is huge. We see many times when it is related to hormones or certain other nutrients of the body or deficiencies of the body. When those deficiencies change or the hormone levels change, our treatment also needs to be changed. So we have to be very, very specific, and it continuously needs to be monitored. I cannot say that, oh, I'll give you medicine for psoriasis for 1 year and you keep on taking it. No, it cannot be possible. You have to continuously follow up the disease, and at certain diseases, certain stages of the disease, you have to change the treatment. And that is why it is more difficult to treat as well, right? We usually know it as a very dreadful disease and very difficult to treat. This is the reason, because you have to be very careful about each and everything, very attentive about everything. Before starting the treatment, basically, you need to establish the trust with the patient, because patient has to be there for a very long term. Many times, because these treatments, because they are chronic, it takes a bit of time to show the results. And so many times what happens is the patient is there with you for a month or 1.5 months, and they have not seen the results, and so they go to some other doctor, and the treatment starts from absolutely first stage. So then in that condition, all the work that was done already for that 1 month or 1.5 month will be vanished. So that is why it is very important to make the patient understand the complete clinical course of the disease, give the patient complete understanding about the disease, and then move forward so that the patient has trust in the doctor and the patient has exact understanding about the disease. You have to provide patient with information. I always say that patients are always to be taught about the disease first before the treatment. And that is why this series of disease related webinars also we have been doing, so that you understand, and the patients of psoriasis basically understand how their disease goes. You may see all different types that we talked about above today, and you may think, oh, is this of use to me? No, everything of this is related. And so for you to understand your disease is most important, because that is how you become serious about your disease, and you just don't leave any stone unturned to treat your disease. The general measures basically will be reducing or eliminating the potential trigger factors. Even if you may not be doing any of these, it is always good to stay away from this as much as possible. First is stress, most important thing. Smoking, again, very, very important precursor for psoriasis. Alcohol, again, very, very important precursor. Stress, smoking, and alcohol are the three major or the three most known causes for occurrence or triggering of psoriasis. Trauma, drugs, any medicine that they are taking, If they are allergic to it, if they need to change it, you have to understand. If there is any infection, internal infection, any kind of inflammation other than the psoriasis, you need to treat it, because until and unless you don't treat it, you are not going to cure the psoriasis in the body. Factors for selection of treatment, basically, how do we select? It depends. Yeah, if it's childhood, adolescence, young adult, or a middle age greater than 60 years of age, it can be different for different people, right? Type of psoriasis, as we saw, plague, plumber, generalized pustular, erythematous, anything, right? The site and extent, we all know it can be localized only to scalp, only to palm, scattered plaques all around the body, but less than 5% involvement, if it is there, of the whole body, it's a different kind of treatment. If the involvement of the whole skin is greater than 30% of the total amount of skin, then the treatment would be very different. And maybe we need more of Panchakarma treatments there, where we need chronic cleansing of the body. We need recurring, again and again, we need to cleanse the body with Vaman or Virechan or such other Panchakarma therapies, the biopurificatory therapies, according to Ayurveda. Whatever previous treatment has been given by modern doctors, because usually there's a very deep thing into patients. They would go to modern doctors first or take the allopathic treatment first. And there they might have taken a lot of steroids, a lot of methotrexate like medicines, which are known to suppress the immunity, which can again cause other infections. Or if that gets deposited into the body, you need to cleanse that first. So you have to be careful about this. There can be associated medical disorders like HIV or chronic vascular diseases or cardiovascular diseases and all such things, which you also have to take care. The duration of disease, if it is less than 1 month when the patient has discovered the skin patch or the skin lesion, or if it is less than 1 year, or if it is more than 1 year. In Ayurveda, we usually say that for such disorders, if it is less than 1 year since the first site of lesion, then it can be completely cured and in a very, very, very fast way. So that is how we say that as early as you can enter Ayurvedic treatment for your psoriasis issues, the better. If it is mild symptoms, recent origin, and it is just localized, in that case, the first thing that we do is we go for a Virechana. Virechana is a therapy where we, for the first 5 days, or 3 days, or 7 days, depending on your body's condition, we give ghee to your body. So we basically oil your body so that all the doshas that are involved in creating the disease increase. And then on the for 2 days we do massage and steam and everything to collect the disease. What happens now into this, I'll tell you later. So now after this, on the 8th day, 9th day, or 10th day, depending on the ghee, we will give you medicine so that you get purges. So this is basically therapeutic purgation. It can be 10 times, it can be 20 times, it can be 30 times in 1 day that you get your purges. And so the excess of vitiated doshas gets removed out of the body. Now, what happens into this is when we give the gritpan or the ghee for the first 5 days or 7 days, and then when we do the massage and steam to the body, the skin lesions actually increases. Instead of decreasing, it increases because we are increasing the doshas. We are bringing it out from the root of the body. So the skin lesion on the external surface during this time increases. But as soon as the Virechan is performed on the final day, the skin patches goes away completely. And within few days, when your diet after the Virechan is designed, uh, it occurs that within 7 days, within 10 days, all the skin patches goes away. So if there is any SAM, that means if there is some kind of AMA involvement, that means if there is undigested food, your digestion is weak, then we use certain other things. These are the name of the medicines, the Avipatti Churn that you see in the first place. Then the Shadharan that you see, these are the medications through which we use for Virechan. There are certain bitter medicines, decoction of bitter medicine, that is Mahatikta Kashai, that we use. There is a medicine known as Kaishor Guglu that we use. These are tablets, Manasmitra Vatakam, for psychological support to the body, right? Then there is Manasmitra Vatakam, Gandhak Rasayana, Vitpal Care Tel. We also give certain coconut oil, medicated coconut oil, to be applied on the skin lesion for psoriasis. It actually works very wonderfully. Even for cosmetic reasons, it works very nicely because it suppresses the external symptoms and you don't see it. But it also works internally deeply because it nourishes the skin, and it also works for the immunity to understand that it is your body. So this is the approach that we do to a milder, recent origin thing and a localized version of psoriasis. There is another protocol where their symptoms are moderate, a bit more. The history is of 2 to 6 months, and the area afflicted is a larger area. In that condition, we have to first start with oral medications like Mahatiktam Ghritam. That's a ghee medicine. It's a medicated ghee, medicated clarified butter, basically, that you use, for which with which we do snehana, and then we do virechana. Then we go for the medications that we used. Into that we add a bit more of potent medicines, the Arogyavardhini Vati or such medicines, which cleans any, say, if there is a patient who has taken modern allopathic medicines for a very long time and there are deposits into his liver or her liver, and that we need to clear out. We need to clear out the toxins. We use this Arogyavardhini Vati. If there is an allergy, a lot of itching related, we use Haridra Khandam, where it's a combination of turmeric, ghee, and natural form of sugars. So that is used. The external application and all such things remain similar, but the potency, the dose will always increase with it. The external treatment, as I said, Vitpal Care Tel is a medicated coconut oil. There's a Siddharthak Snan. This is a powder with which we ask the patient to take bath. Instead of using soap or any other liquid, chemical or synthetic liquid, we ask this powder. It's a medicated herbal powder, very good smelling with lotus flowers and everything. So this is used for taking bath. We also give takradhara. We basically, what we do is, we make buttermilk with a herb known as musta and amla, the Indian gooseberry, and musta. Right? These two herbs are used to make buttermilk, and this buttermilk is used to pour on the complete body of the patient. This also works very well. This is also one of the Panchakarma therapies, known as dhara, takra dhara, all over the body, basically. So it is wonderful. If the symptoms are very severe, if the history is more than 6 months, spread across the body, has been throughout the body, and has a huge mental stress, in that condition, the first thing is to improve the strength of the patient. Then we go for Rukshana. First, we dry up the lesions there. First, here we use the Takradhara, that is the buttermilk bath. Then we go for improving the digestive fire of the patient. Then we go for the Snepan, the ghee. Then we do massages, then steam, then nasal instillation of medicine, and then Vaman, the therapeutic MSs that I was talking about. We make the patient vomit out things. And after that, after 7 days, Virechana, where we do the medicated purgation. So here we have to extensively use the biopurificatory therapies, basically, and prepare the whole body for the whole procedure. Because many times what happens is, when the patient is not very strengthful, or the disease is very strength or overstrength, in that condition, the oral medications or simple virechana, simple therapeutic purgations doesn't work. So the therapies also have to be a bit harsher in that condition. Usually we call, as I told you, for follow-up, we call the patients and we give different kind of medicines. Here, all the medicines that are used are more potent than the above medicines that we talked about. So this is basically the complete medicine thing that I have used. But still, it is very, very important, as I told you, to be under the observation of an expert Ayurvedic doctor only before taking all such treatments. You should not self medicate yourself, even with the herbal medicines or Ayurvedic medicines, because you don't know which condition or which stage your disease is in your body, right? Now, there are certain things that you follow with diet and lifestyle, which becomes very, very important into this. You have to avoid any opposite potency drugs or medicines. Now, the simple example of this is many times into the modern world, we see a lot of cooking of fish with cream or curd or milk or such milk products, milk related products, right? So, in that condition, I usually say that that is to be avoided, because when you take two mutually contraindicated things like fish with milk or salt with milk, now you would say, oh, no one would eat salt with milk. But many times we take tea or milk along with some snacks which are salty, which is also a viruddhahar. So, you have to avoid all such mutually contraindicated food items. Then there are certain vidahi, that means certain burning type of food items, which is like a jalapeno, a vinegar, a soy sauce, a ketchup, or all such things which will increase fire into your body, which is not the natural digestive fire, but which is a pathological fire. All the guru heavy food items, say breads, anything made with very fine flour, abhishandi, that means things like curd, yogurt, or any sticky food items, cheese, butter, all such things. Navan, newly formed grains. We usually in Ayurveda say that you always have to eat grains, maybe rice, wheat, anything which is kept for 1 year and you use only after that. Whenever you use before it, it has the potency to cause diseases in your body, and especially such diseases where there's a lot of indigestion, lot of all such things happening to your body. You can include more of uh, turmeric into your diet, garlic, black pepper into your diet. That is absolutely fine. But you have to avoid pickles, curd, no curd at night, especially, no buttermilk also at night. Fermented food items you have to avoid bakery items, anything which is oily, anything which is spicy is not good for you. Strictly avoid eggs, beef, pork, which are very heavy for you to digest. Avoid ready to cook items because they have a lot of preservatives, which can again be vidahi, which is burning in nature. Tinned foods, etc. Right? Avoid re-cooking refrigerated foods. Even that is one of the biggest reasons for occurrence, triggering, and relapse of psoriasis. So you have to be very, very careful with these food items. Try to be very simple with your food. I would also say that no raw food items, because raw food items, unlike our belief, are difficult for our body to digest. It means more energy for our body to cook it and then digest it. So you have to be careful with that as well. Practice achar rasayan, basically that means moral code of conduct. The moral code of conduct: behave good with others, don't be envious, try to calm down your emotions. These are the psychological things that you follow, because that is also one of the biggest reason. You cursing someone is also creating some kind of effect into your body. And that is why into psoriasis we say that don't even curse someone else, even if they are not there in front of you, because they may be affected or may not be affected, but your body certainly gets affected with negative emotions, negative hormones, which causes harms to no one else but your body. So chronic inflammatory disease of the skin, is psoriasis. The classical presentation is red, scaly plaques. The management should address both medical and psychological aspects. You cannot leave the psychological aspect. So we call this as a psychosomatic disorder. So it is very, very important to manage that. And the treatments may include external therapies, Pancharkarma, basically improving the ras, that means the lymph and the liquids of the body. The blood purification therapy is very, very important. Blood improving therapy is very important. Manobal Vardhak, that means improving mental strength of the patient, is also very important into this. Rasayan Chikitsa, improving the quality of life, giving drugs and herbs which can be used for a long time, which improves mental and physical strength of the body. These are Rasayan, which brings the best of the body out, is Rasayan. And again, the Rasrakta Prasadan that I talked about. So improving blood and the lymph and the liquids of the body. So that is for you, psoriasis. I'm Dr. Dhanwantri Jha, and in collaboration with Karunamai Holistics Canada, we have done this thing on psoriasis. I'm sure you gained a bit of knowledge. You can go again back to the video on our platform, Karunamai Holistics, and you can go revisit the video if you have missed certain things or if you want to revisit it. But certainly there are many aspects, and I would say mostly the mental and the physical aspects both have to be taken care of with psoriasis. So I hope you have got a bit more of information about your psoriasis. So be careful with that, and as soon as you can, see an Ayurvedic doctor, an Ayurvedic physician for your psoriasis issues. Thank you so much. If you have any questions, please let Gauriji know, and Gauriji would further respond.
Yes, if any of you have questions, please raise your hands and I can ask you to unmute one by one to ask your questions. Anyone has a question? It was just so elaborate and so well done. Like all the slides were so beautifully explained. Though some of the pictures were very scary to watch, but overall, I think you covered it in so detail that I'm speechless. I don't have.
This is a very scary disease, and that is why I talked about that stigmatization more. And the patient literally falls into a vicious circle, because many times what happens into this is there's a stress, there's an emotional factor related, and once you start seeing that, until and unless you don't suffer from psoriasis, you don't understand that. But when we see patients, we see they are literally crying, and it is more dreadful. Many times you believe, why is this skin thing that much more thing? But because we live into this modern world where the cosmetic thing, where the appearance becomes much more important than anything else. So the patients are literally stigmatized because there's a stress already, and then this adds on to this. So that is also the reason why the stress increases. And yes, the pictures, absolutely, not just the pictures, even the suffering is very huge.
But is it possible there could be other causations as well? Because my landlord had psoriasis, and he doesn't like he's lived a very like clean life because he never smoked, he never drank alcohol from South India. I don't see him more of a stressed person. Maybe he doesn't say, or maybe he's more just a quiet person. But it doesn't look like he's stressed. He's pretty healthy. He follows healthy routine also. But he had psoriasis, and he healed himself with Panchakarma in a younger age only. Like he said, he had it and he healed himself with Panchakarma, and he does Virachan every single year. He goes through the Virachana cycle every year. He goes for the massages. He does the Gritpan and Virachan. Like he tries to do it every single year, and he follows Ayurveda very closely because he healed himself. Like initially he thought it was dandruff.
Yes, I get your point. So there is huge this thing, Gauriji, that it has a genetic predisposition for sure. But the chances of that happening into a person is very rare. That means if you say there are 100 patients of psoriasis, there is maybe a 0.5, so not even 100. So say 1,000 patients of psoriasis, there are one or two out of 1,000 which where the reason is the genetic cause, where the genetic linkage is very strong, or many times because there is one more thing that is happening nowadays. Out of these 1,000 patients, 5 patients who are living properly, one or two are having that genetic cause, and 5 out of these 1,000 are because of pollution related things,
Yeah, that's what I
environmental
was.
thing related thing. Yes. So these two things which you don't have control on your body. It's about the surrounding thing. Nowadays, there's an institute of Ayurveda, big institute of Ayurveda in Delhi, the All India Institute of Ayurveda, IIA. There they did a recent study and they found that into places around Delhi NCR region where the pollution is not so much compared to the places into main areas of Delhi, the recurrence of or the incidence of psoriasis is very less. So they are showing that linkage as well, that pollution is hugely related to recent origin and recent forming modern psoriasis.
Yeah, that's exactly what I was saying, that that initially there used to be diseases, but in few. But now it is increasing because of a lot of maybe other factors contributing. Also, the cosmetics and the products that are currently used are full of chemicals, and so there could be many other factors that could be, because almost everybody today is consuming chemicals. Like, not everybody is into Ayurveda. Very few people are um, going down the holistic route to go the natural path. Most people are still they go and use things available in Walmart or stores, like the cosmetics they buy, the shampoo they use, and things like that. So it could be that there are a lot more factors today that are contributing to.
Absolutely, absolutely. One more huge reason is the use of pesticides and the worm killing things that they use for all the plants and food they grow, right? Because farmers are also into huge stress. And so, to preserve their crops, what they do is they overuse the pesticides when they are not known or when they don't know exactly. And even with the increase of industrial areas into rural places in India, what is happening is the industrial waste is being poured, it goes, mixes with the water, that water goes into the fields and it shows a huge amount of lead, phosphorus, or such things into the soil, which comes to the plants because plants usually take them from the fields or from the farms. And even that is one of the very big reasons. This is another study that was done into Bombay. The plants grown into the outskirts of Bombay where there was industrial waste. They found a huge amount of lead into that, and that also was a very huge contributing factor for psoriasis and prevalence of psoriasis in that area.
Yeah, that's exactly what I feel today, is that like you might find now people who don't take stress, who are not who are living a healthy lifestyle, and they are still suffering, and it's a lot of environmental factors that are going into it, which is very tragic, because uh, we are clearly seeing that now, like, maximum people are definitely, like, not eating the healthiest of food, even if it is considered healthy, and they're not using
Absolutely.
healthiest of products, even if they are considered healthy, like, so for sure. Priyanka ji, you have your hands raised, so please unmute yourself and ask your question.
No, I don't have question by
Yeah.
mistake.
No, this is Priyanka here.
There's
Okay.
another Priyanka, two Priyankas basically.
Yeah, thank you, Gauri. Like, usually I don't have a very specific question. It was very elaborative presentation, and thank you for Dhanwantri Jha, for presenting a wonderful session. Yeah, it's it's a very elaborative and really glad, like, like it was just refreshing all my knowledge and everything. I'm polishing myself with all the theoretical aspects.
Thank you so much, Priyanka ji, for attending.
Yes, it was a wonderful session. Thank you for that.
Yeah, it was.
Thanks to Gauri ji basically for working so hard, for taking this out for all the people basically. And we are continuously working with Karunamai Holistic to take this forward. And we are doing a lot of activities. Gauri ji is also coming up with a course on Ayurveda. So if you guys want to join that, that is also wonderful. If you want to learn the basics of Ayurveda, in November or December, we will start with that course. Most probably the November last week, we are going to start with that. So if you wish to learn more on Ayurveda, how Ayurveda basically sees health, what Ayurveda does to improve the health of humans, or how Ayurveda is different than other things. It is not just a course basically designed for you to understand how it is a medical science, but it is more on how to use it for yourself and your family. Gauriji is also working with Karunamai Holistics to take certain food things now, because everyone wants that what kind of food should we eat. So we are also planning to take all such things where we can bring recipes, we can practically show you and teach you what recipes you can take. So that is also into the pipeline basically with Karunamai Holistics. So please do join us for that. Please stay in touch. Also do leave your emails or your contacts with Gauriji. And if you have any questions related to Ayurveda, you can always ask. No matter if you don't join our courses, not an issue. But please do join with us into this effort of taking this very holy science of Ayurveda, which is a holistic approach, teaches us the way of life to the whole world. Especially we are spreading this into North America. Gauriji being very closely related and associated to Canada is working for that in Canada as well. And we are spreading this to the whole North America. So thank you so much, Gauriji, for this. I hope you liked the session. I tried my best. Thank you.
No, it was very informative, and it was very elaborate. So I'll probably watch it again, and I definitely don't have any questions because you were very detailed in the presentation. And I am hoping that whoever joined today, they were able to learn, and whoever will watch the video will be able to learn something. And yes, we are soon hosting a course with Dr. Jha on our platform. It's an online course, and I'll send out an email regarding the course to everybody. And Dr. Jha is going to be back with more webinars on our platform, some recipe classes, like he said. And so he will be able to teach us about how to cook healthy, how to live healthy, and follow a holistic, natural path towards healing with Ayurveda. And the best part about Ayurveda is food combinations, which is why we wanted Dr. Jha to teach us some recipes, because Ayurveda does not say this food is good or this food is bad. It says the combinations can be good or bad, no matter what you eat, whether you're a vegetarian, whether you're a meat eater, whether you're a pescatarian, whatever, vegan, whatever. But it is mostly the food combinations that can go wrong. And of course, we are a vegetarian platform, so we'll have mostly vegetarian recipes that we will be sharing. But nevertheless, you're more than welcome to contact Dr. Jha directly if you ever have questions regarding your lifestyle, any of your problems, or your diet. No matter whatever diet you follow or whatever lifestyle you have, you can obviously go to him directly through our platform. He is one of the doctors on our consultation platform as well. So you can contact him. It's on our website, Priyanka. I will send out the email of our website where his consultation profile is set up, so he can give you a direct consultation on Zoom, so you can talk about your particular condition.
Hi, Gauri. Sorry for the interruption. No. In Canada, where is it located? Because I stay in Mississauga. So, like, I'm also professional and Ayurvedic doctor. So I just want to, that is the reason I said, it was refreshing all my knowledge by listening Dr. Jha's presentation.
Yeah, it's not located anywhere in Canada. The consultations are online. So Dr. Jha is going to be giving online consultation through Zoom. So,
Okay.
yeah, so people who have any questions regarding any problems they are facing with their health, or any questions regarding lifestyle management or their diet management, anything, Dr. Jha is able to guide in each of these spheres. And though we are a vegetarian platform, he's not limited to that. So feel free to contact him for like any problems that you might be facing and you want to reach out to him.
Sure.
And I will share the website link for reaching out to him, and I will share about the course as well. So thank you so much, Dr. Jha. This was a wonderful webinar. Thank you so much.
Thank you everyone for joining.
Thank you. We
Bye-bye.
look
Take care.
forward to
Have a
more.
nice day.
Yeah, have a nice day. Thank you so much.
Thank you all. Thank you. Bye.
Thank you. Bye.
Thank you so much for the presentation. Bye. Have a good day.
Thank you, Priyanka. Thanks a lot. Bye.
Bye.